when you're a lab person, you like things in a line, you like to do things a certain way and execute it one at a time. And then the pandemic hit and we were all just rocked.
I just remember having to lock up PPE to save it for the hospitals if we need it, or using gloves that may be the wrong size for a little bit until we get more.
We were a day shift only operation, and they turned around and they were being asked to turn that stuff around 24 hours a day, 7 days a week, people constantly calling, tremendous pressure.
Sometimes the stress got to people and it was just like, what am I gonna do? And that's when you have the people that are having one of their good days saying, let me help you.
It was overwhelming, but at the end of the day, we're pretty proud of what we did.
A typical validation process can take, weeks to months to go from beginning to end.
In this case, the kits that we used for COVID testing arrived on our dock March 26th at 9:30. By about 3 p.m., we were fully validated, ready to run patients.
Within 24 hours, we had reagent, we had the samples validated, and testing and patients were being completed.
A lot of people definitely volunteered to come in earlier during their shifts and help run some COVID testing. Some people stayed later.
I had techs that would work like 16 hours, 18 hours just because they'd work their own shift and then come here and work another shift. Just seeing everybody come together, and supervisors are out here and managers are out here, and we're all just trying to help each other out.
We couldn't be more proud of the work everyone did, not only initially, but then just throughout it, and then they kept the pace to meet the needs of our customers and our patients. I think that there is kind of this perception that lab's just this commodity that just gets done in the background. Once it became apparent that we could deliver that at Path Lab, people really then appreciated what we did.
People were able to proceed with their surgeries, their life-threatening surgeries, and you just really realize the impact and the amount of people that you're touching. It has been rewarding seeing how it's come together, how it's brought everybody together more, not just within the lab, but within the whole hospital system.
It brought the team together because they could see how important they really are to patient care.
I think what makes someone a hero is doing what needs to be done, not because they're comfortable with it, not because they want to do it, but because it has to get done. And in the case of COVID testing, we were the only ones that could do it. So I think that's what makes everyone here heroes, is because they delivered when no one else could.